Hello, this is Dr. Gay from First Look MRI, and this is a 41-year-old male who fell about 3 weeks ago, injuring the shoulder, and the pain didn't go away, so they went to the orthopedic surgeon and they ordered an MRI, and the rotator cuff looks good. This is the supraspinatus muscle coming horizontally. The supraspinatus tendon is here. It has a little bit of tendinosis or low-grade strain, but no tear. The bones all look good, but the patient did have one other finding that's anterior to the shoulder. So on the axial images here, we see some brightness on this axial proton density fat suppressed image. And in front here, the pectoralis muscle and tendon come horizontally across here, and it attaches on the outside here, superficial to the biceps tendon. It helps hold the biceps tendon in. And when you see brightness in this area, we worry about a tear. We can see over here some irregularity. This is probably the distal muscle fibers that are torn. And we see this brightness all through here. So this is edema along the course of the pectoralis tendon and muscle. So it looks like this is torn and retracted back. We did some other views. Here, this is a sagittal view to see. And we see the front, back, top, and bottom here. And on this sagittal view, we see the central tendon here. This is the muscle, part of the pectoralis muscle here in the front. This is part of the central tendon coming here horizontally. We see it thickened, irregular, and the torn end is maybe right about here. Again, this should go all the way over here to attach to the humeral head or humeral neck area, but instead it's torn and retracted back. But these are often hard to see. Sometimes there's not as much fluid, and the the pectoralis tendon can be very small and thin. But in this case, we're very confident this is the muscle belly that's contracted back a little bit. This is the central tendon that's thick and irregular, and there's that edema, the telltale sign of a pectoralis tendon and muscle tear where the tendon's retracted, and there's a little trail of edema or hemorrhage along the course. So a pectoralis tendon rupture with a retraction.